Let's welcome on board Dr. Abhay Soi, the CMD at Max Healthcare Institute, joins in on right now. Dr. Soi, great to have you on the show. We've seen a good growth in your EBITDA as well as margins, even though 100 new beds were added this time. What was the margin profile on the new beds? And on consolidated basis, where is it that you see your margins sustaining?
Absolutely. You've seen actually 100 new beds which have come in, Brownfield expansion, and immediately in the first month itself, they've been accretive to EBITDA. So EBITDA percentage from those beds are more than 35%. We have another 300 beds coming through in Dwarka sometime in September, October this year, which should be accretive going forward as well. Yes, we are looking at margin expansions basis some of the new capacities which are coming, as well as the payer mix distillation that we are having, the clinical mix distillation we are having, and the little bit of annual price increase that we have, of course.
Have you seen, now we've seen a consistent jump in your ARPOB and occupancy levels since last 4 quarters. Do you believe these numbers are nearing peak or the trend will continue?
Well, I keep answering the question with respect to ARPOB every quarter. So we've been hitting record numbers every quarter for the last 5 or 6 quarters, in fact, and you've seen sequentially ARPOBs have been increasing quarter on quarter, whilst every quarter every previous quarter has been the highest quarter, the subsequent quarter sort of beats that. In my mind, this is definitely not the sort of peak. I've also guided to the fact that about 30% of our business, which is institutional, there's some amount of distillation also, which is going to happen, which should sort of help us obtain higher ARPOBs, because the ARPOBs from institutional business are less than 50% of what our normal business ARPOBs are.
Right. Thanks so much for taking time out and joining in. Dr. Soi, your international business, the contribution stands close to 9%. What is the outlook in terms of growth in FY24 for international business?
So that's gone up to about 9%, a little over 9% of our total revenues are coming through that. We've seen a massive increase over the last, of course, year on year as well as quarter on quarter, as far as international business is concerned. And, these numbers are very healthy. Of course, structurally, I've always believed that this is not even the tip of the iceberg, so a lot more to come through.
Right, and NCR and Gurugram market, they continue to be your key hub, but we are seeing increased competition as well, right? Especially in Gurugram. What is Max's strategy then to fight the same?
So interestingly, we've never been the first hospital in any micro market, yet we're on ARPOB, on occupancy, on EBITDA per bed, and pretty much every financial and operating parameter, we outperform the rest of the industry in every micro market that we compete in. We believe Gurugram is not going to be any different, particularly because it is our backyard. We are the largest healthcare players by far in the National Capital Region. And as you're aware, Delhi, Noida, and Gurugram are a tri-city. In fact, 40% of all our doctors, which is 4,800 senior clinicians, 40% of all our healthcare workers, which is tantamounts to about 40% of about 20,000+ people reside in Gurugram. So really, this is our backyard, and we feel very, very we believe we have a comparative advantage here.
You've already shared your long-term expansion plans worth 4,000 crores. Can you update us? Where do things stand at the moment?
Absolutely. So we are looking at 300 beds coming through in Dwarka in FY24. We have another close to 1,000 beds coming up in FY25. Over the next 3 to 4 years, we have about 2,900 beds coming up. This is going to be at a cost of about 4,500 crores. This is perhaps the largest capital expenditure outlay in the healthcare sector declared by any hospital chain so far.
Right, and one of the recent forays that you've had is Max Lab. What exactly is the growth strategy here?
Well, we've had a CAGR, we had a significant CAGR over the last few years. Even I think in the current year, it's 35% plus growth in Max Lab business that we are seeing. This is year on year, and there's a sequentially quarter on quarter increase as well of about 10%. So we believe, we have again a significant comparative advantage, considering the fact that we come with the hospital credibility behind our laboratory business. So this will be growing for us at a very fast clip, and we're quite confident about this business going forward.
Okay, thank you for taking time out, Dr. Soi, and giving us a view on how things are shaping up and what the outlook is for Max Healthcare. That's the stock price currently at about 514.